Good afternoon, everybody. First of all, I would like to thank CARPL for inviting me to share a little bit of our experience with the platform. My name is Henrique. I'm a radiologist at Albert Einstein, and today I'll share a little bit our experience with the platform. Uh, Before I dive into my presentation, I'd like to give some context about the hospital for those who don't know it. All know that today context is everything. So Albert Einstein Hospital is a non-profit organization. It was founded in 1971, and since then it has become a reference in treatment and humanized care, and it has expanded its border with technology, with different sites, and so with some public-private partnership. That's why we have 7 hospitals, with only two of them are private. More on that later. We've always prided ourselves on our work and our commitment with the state-of-art care, warranting us some international recognition among the best hospitals in the world, the best specialized hospitals, and smart hospital as well. And how do that? We basically try to help transform healthcare across in Brazil with social impact based on 4 main pillars. 2 of them is the private and public part that we already discussed, but we also have some one branch focus on teaching and education, and the other in research and innovation. I'd like a little bit in the private public healthcare, where Einstein work with public health organization administrators, trying to meet their needs in care, technology, on research project as well. I think it's important for me to stress that public health in Brazil, it's universal and free for everyone. So, which means this is a very big challenge for our health minister. And if you see here, we have like 29 units in the private branch and 36 units in the public one, reassuring our Einstein commitment to its philanthropical nature. Okay, this is the hospital. So let's talk about the challenge, more specifically, the challenge regarding AI. First of all, our patients comes to the Einstein Hospital looking for the best care level, highest level of care they can get. And most recently, we've been making use of AI to provide that. Of course, in the beginning, we thought it would be quite easy, a simple process, just select the best product in the market and deploy that in our system. However, in reality, it's more complex than that. We have a lot of stakeholders. We have a lot of um, discussion that we have to do this internally. So any kind of project or any buying decision should walk a very long and winding road. That looks more like this. It's a little bit like a neural network that we hear a lot in research papers regarding AI. And this is the first model that we structured, and it worked really well. So well that we started to do it a lot of times with this huge influx of AI products in the market. We managed to reproduce that successfully in many cases, once, twice, third. So in the end, we have something like this, as a natural neural network. Our neurons, our connection got better and stronger. So, which means that our professionals, they were more aware of the roles. Our process got streamlined, with somewhere optimized. And was basically the scenario that we have like 2 or 3 years ago. But now we are facing a new challenge, So, as I mentioned before, Einstein was expanding throughout these years from public and private healthcare. And right now we have this kind of problem. So on one side, we have a number of AI products that is coming to the market. On the other, we have a more complex and diverse systems within our administration. Why is that? Why we just don't, connect everything in the same packs or in the same system? Unfortunately, in Brazil and probably in many countries in the world, we have difference in how we can do this. Like, for instance, simple examples, the connection between a private and public hospital, that won't be easily feasible for security reasons, for private patient reasons, and also the contracts, the reimbursement models, they're not the same. Even in their private branch, you can see difference in different states. So you need to address this problem a different way. Of course, one could tell, oh, why you just don't replicate that you had, just do it like this. It's at first I could say, okay, it makes sense, but it took some time for us to train, mainstream our process. This wouldn't be possible in a short time. So in reality, you have this. You have more products come into the market, more hospitals into our system, and we maintain the same team. So in the beginning, we made do with what we had. So we started doing things that how we always did. And it was going well, but it such got messy. Things was getting harder and harder to keep track the projects, and it's not getting anytime easier. And we decided to maybe stop because we were afraid of this. Like, we didn't have only critical process dying, but we were getting really, really close to that. So we decided to let's rethink the way that we're doing. How can we take the next step? You need to skip our process because the way that we were doing it was good, but it was not enough, it was not scalable. And how we do this nowadays? With technology. So, in which technology I'm talking about? Of course, the platform, the CARPL platform, not only because it is platform designed for scale up deployment and the use of AI. And the good thing is that we would like to keep in using the main features of the platform, the discover, explore, validation, and deployment. And we decided to we teamed up with the CARPL team and discuss how we can do that. And we came with a very interesting model. Another advantage thing about CARPL is that we're only hospital in Brazil that is a little away from the main centers of AI, like the United States of North America, Europe, and Indonesia. The CARPL platform allows us to get in touch with much more companies that we can do by ourselves. So going back to the problem and how we solved it, we basically bundled all the hospitals and our sites in a new layer of a new logical layer that wouldn't connect directly each hospital with the other, but would connect the hospitals with a single server that would make its connection with the platform itself. So, in this way, we could focus in our job, like providing healthcare to our patients, maintaining our teams, providing provision all our RT systems, and CARPL would handle the rest. And another advantage in this is that we could also bundle some contracts, some clauses for contracts, for security, um, some formulation clauses that it in a bundle that we could work in a more streamlined way. And of course, it was only possible because we could do like playbook, which we could describe some basic and simple parameters so we can afford it. And also we got some present surprise, something that we didn't have before. So since it got a new layer, new logical layer, we were able to capture some data that was or left or siloed in the vendors or siloed in their packs, and we couldn't easily access that. But since we have this new logical layer and data running through that, we could capture that and have more insights about to what's actually happening in our systems. So to sum up, I'd like to say that not plug and play. I'd like to take one further. I'd say that extracting a value from AI radiologist is not plug and play. You always need some kind of customization. The architecture in healthcare is complex, as I showed you. And last but not least, a platform can help us institution by allowing us and focusing, providing allowing us to do what we do best, which is providing healthcare to our patients. Thank you, everybody.